Good morning, good afternoon, or good evening to all of you from all over the world. Thank you for joining this presentation about our Master Clinical and Psychosocial Epidemiology. I am Floor Veldhuis. I'm the study advisor of this program. So if you have any questions now or in the future, please feel free to reach out. My contact details will be at the end of the presentation. And I will introduce you to some other speakers who are here today as well. Because during today's presentation, I will explain to you what we stand for at CPE, what CPE is about. So what does the program look like, but also what are the career opportunities afterwards. We'll tell you something about who can apply. And then our student Maria, she's a current student in CPE program, will tell about her honest experiences with this program. And then we have alumnus Mateus. He graduated a couple of years ago, and he will tell about the next steps he took after finishing this master. And then, of course, at the end, there is room for Q&A. We would like to invite you to speak through your microphone so we can all hear your question. But if you really feel like not doing that, then of course you can also add the questions in the chat. But we really would like to interact with you and hear the thoughts that you have or the questions that you have. Please make sure that you ask all the questions that you have today because we're really happy to help you make a decision in the next step in your study time. We are recording this session because not everybody is able to join at this point in time. So be aware that this is the case. And we will also make sure that we will send you the recordings after this presentation together with some additional information. So what do we stand for at CPE is high quality education. It's a small scale cohort and we are a selective master, as you might noticed. And this selection means that we are really looking for highly motivated and interested students. If you feel like, nah, maybe I'm not the best ranked student in my year, maybe my GPA isn't the highest, don't worry too much about that because motivation is one of the key aspects in this selection process. We are really looking for a small group of students that can work together in a very motivating environment. So don't hesitate applying if you feel like you're not the best one. That's not particularly also what we're looking for. We're looking for highly motivated students. So this is an invite to all of you. Within this master, you have the opportunity to do high quality research. You're going to work with the top researchers here in our University Medical Center in Groningen. And we also collaborate with a lot of other faculty members from faculties all over the university. To give you a little bit of an idea about the end level of this master, you will be at the level of a first year PhD student. But it doesn't mean that you only can become a PhD student after this master. There are plenty of other career opportunities lying ahead, and we will come back to that later. Another strength of this program is that we have a very personal approach. We focus on your individual development, and there's also a lot of room for creating your own path along the interests that you have or alongside all your ambitions that you have for the future. We have one-on-one supervision, for example, by senior researchers who all know you by name. You will also be part of a research department, or becoming part of a research community during your second year when you're doing your master thesis in one of the departments within the University Medical Center. We have a lot of interactive classes. So we are not only looking for providing you all the knowledge and you're just listening. No, we're really looking for collaborating, for interactions, for discussions. We're thinking along together about the health challenges of nowadays. So that's also good to keep in mind that it is an interactive program. And another beautiful aspect of this program, according to me at least, is that we have a professional skills training course that is running throughout all the years, but we'll come back to that in a little bit more detail hereafter. So what is CPE about? within CPE, we believe that if we are looking at the health challenges nowadays, the physical and the mental health conditions and diseases, it's not possible to only look at them from one single perspective, for example, a biological perspective. We need an interdisciplinary approach to better understand the health challenges nowadays. This means that we look into the biological, social, psychological, and environmental factors because we believe they all play a role in the onset, development, treatment, and prevention of physical and mental health conditions. So we need all these pieces of the puzzle coming together to understand them and also know what we can do about it. And that's also one of the reasons that we admit students from very many different backgrounds, because we believe that we need these in order to be able to, to improve health and healthcare systems. So what kind of health challenges can you think of? We can think about the aging population, we can think about chronic diseases, we can think about lifestyle choices of people, the mental health of youth, at least here in the Netherlands, that's a lot in the news nowadays, but of course it can be about mental health of anyone. Well, the pandemic's a beautiful example has been COVID-19, which is perfectly fitting within this program, but also thinking about socioeconomic health differences and what are the influences of that on our health of our populations. There are also very many more health-related aspects that we can think of. I will tell you now a little bit about the program and its structure. There's a CPE core curriculum, and there are two tracks. One is called Health Systems and Prevention, and the other one is Life Course Health Development. And approximately the division will be that together with all the students, 60% of the classes are taking place, and 40% will be within one of the tracks that you're choosing. So within the track, you follow some track-specific courses, you follow some electives, and your master thesis project is also within the domain of the track. I will explain more about it, but first the core curriculum. In year one, in the first block, it's all about exploring. It's about exploring the health-related challenges in society nowadays, but also what we expect in the future. In the second block, it's about unraveling the pathways to health and the pathways to diseases. And in block 3, it's about resolving development and evaluation of interventions, for example. And in block 4, it's all about preparing and about designing new research, for example, the research that you're going to do in the second year during your master thesis project. The courses, just shortly listing them, are in the first block, chronic disease epidemiology. You will learn about study designs and how to do interdisciplinary research. There's a course about the development and evaluation of health and measurement instruments in block 2, together with advanced statistics and some track-specific courses. In the third block, there's understanding behavior change, complex intervention research, and again, there's room for track-specific courses. And in the fourth block, there is room for electives. You can choose courses from everywhere within the University of Groningen, so it's broader than only our program. There's a course about scientific integrity, and you're going to work on the develop a research proposal. Together with these courses, there is alongside also a project-based learning assignment in each block. So you're going to apply what you're learning in these courses during this assignment. And these assignments are together with the students from the different tracks to, again, profit the most from the different perspectives. And an example of this year is, for example, that students have been making a policy. A strategic agenda. And that's for policy making. So they're thinking about what could be what are the questions that we still have about a particular topic. For example, stress. What are the knowledge gaps? What are the priorities nowadays? What kind of new research should be done? And this research agenda can really help policymakers and new researchers to think about what are the next steps that we need to take regarding such a topic. So during these project-based learning assignments, it's important that you're really applying what you've been learning throughout the courses, but that these assignments are also real-world situations. So it's something that is really valuable also for your later career, because probably some of you might end up being in policy working positions. And throughout the whole year, there's also what we call professional skills training, because we believe that you need to have more than only a firm theoretical or a methodological understanding when you want to become a researcher, but you also need skills like leadership, collaboration, creative problem solving. So there's a lot of space also in the program for your professional development, rather than only the theory and methodological skills that you gain throughout this program. And in the second year, it's all about applying. You're applying the skills and the knowledge that you've learned in the first year to your own research project. So you're going to work on your thesis. And like I said, you will be part of one of the communities within the UMCG, doing research in a particular department, working together with the people there, but also with other master students, PhD students. So it will be a very rich experience all in all. And at the end, you will become an independent researcher. Something about the two tracks. The first track I will explain is health systems and prevention. And in this track, you will learn to adopt what we call a health systems approach. And the fundamental goal of this track and this thinking in health systems is about improving equality in health. It's about strengthening the organization of health systems worldwide and to make them accessible, affordable, and also sustainable. How do we do that? Those kind of questions. We also design successful prevention programs and also think about the evaluation. So not only on what is the impact on health or on well-being of this program or an intervention or a policy, but also on the side of the costs. So weighing the costs and the benefits. And also you can do it is part of it. You're going to do a non-academic internship. This can be, for example, in the municipal health service. In the Netherlands, that is called the GGD. But there are also plenty of other non-governmental organizations you can think of, and we will help you with that, of course. In this track, there's also a lot of room for inter-faculty collaboration. So the teachers won't be only from health science backgrounds, but also health economics, spatial and behavioral sciences. Now I'll provide you a short example of HSP research that have been conducted. What we see here are two municipalities in the Netherlands. One is called Stadskanaal, and it's here up in the north in the Netherlands. That's where we are also located. And there's a municipality called Roosendaal, which is more in the south of the Netherlands. And based on its population, the demographics of these municipalities, you would expect similar healthcare costs. That's the dotted line, which you see. The thick line, however, is the reality. So we see that Stadskanaal has higher healthcare costs than expected, and actually Roosendaal is much lower. However, again, based on its population, you would expect similar outcomes. So this is something that can be an HSP question like, what is going on? How can we solve this issue and better understand it to make an intervention? Well, the first thing you would do within this track, for example, is looking at the what. What is actually going on? What are the facts that we have here? And one thing you will learn, for example, is to make those kind of visuals. These kind of visualizations are used a lot for also policy making and advice. So you will learn to do this. And then the next question is, why is this happening? Why are these differences appearing? And thirdly, you're going to look at the how. What kind of interventions can we think of? What can we learn from the situation in both Stadskanaal as well as Roosendaal? well, for now, I'm not going into the more details, but to give you a little bit of an example of what kind of questions are we addressing within this track. Then also some research examples that have been conducted over the years. You can think about evaluating the implementation of a cardiovascular risk management program among patients who underwent coronary intervention. This is a research example that took place here in the UMCG with the cardiovascular department and general practitioners in the region. So this is really a local study. But we also have examples more globally, such as cost effectiveness of a community-based health intervention to prevent and control diabetes in Indonesia. And another example was the exploring the multidimensional nature of social inclusion among patients diagnosed with schizophrenia spectrum disorder. So as you can see, it's very broad, and of course, there are many more topics to be researched. In the second track that we offer, the life course health development track, you will learn to adopt what we call a life course approach. And then the main question is, how can we explain the large differences in health during the life course? So better understanding the biological, social, and environmental factors that influence health across a person's life. And one of the main topics that this life course perspective is looking at is looking at key events and turning points in people's lives. For example, what's the impact of stressful life events, or what's the impact of lifestyle over the years? What's the role of the stages of life? Being a baby, going into adulthood, and into elderly at the end. Social relations, what's the impact of that on our life course? But also geographical and historical aspects do play a role, and I will provide you an example after. Also in this track, there is a lot of attention to prevention and treatment strategies. And instead of an internship, here we have some field trips. So you go to academic and non-academic organizations to be inspired, to broaden your horizon, to learn about the career opportunities afterwards, to network, but also to strengthen your research within this track. And this is an example of a life course health development research or interest. Here we see two people, Noah and Julia, and they are both born in 1945. And in 1944 and 1945, there was the Dutch hunger winter. The Netherlands were occupied by the Germans, and the Germans had a blockade to avoid transport from the farmlands to the bigger cities in the Netherlands. So a lot of people in the bigger cities around Amsterdam, for example, suffered from real serious food. Sometimes I can't find words. They suffered from food shortages, sorry. And what we've learned from this study, and it has become a well-known study here in the Netherlands, is that food shortages during pregnancy really impact the development of your child later in life. For example, cardiovascular diseases and mental health issues, memory loss, for example. And what we see is that indeed Julia is suffering throughout her life from cardiovascular diseases and health loss, mental health, memory loss. But Noah, for example, is doing well. He's just a happy and healthy 80-year-old man. So this is something that is in the LHD track. So really looking at what are the historical or key turning points in people's lives that explain why someone is healthy when he's 80 and the other one not. Other research examples, for example, is the impact of environmental exposure and genetic predispositions in the long-term outcome of schizophrenia spectrum disorders, or the influence of early gestational weight gain on adverse birth outcomes and a mediating role of late gestational weight gain in pregnant women in northern Ethiopia, or, for example, health literacy and the onset and progression of hypertension-related multimorbidity, the mediating role of self-management. So also here you see a very broad range of topics going from more local to more global health issues. Then shortly about the career possibilities. 60% of the students approximately after their master go into a PhD position. It's because they like it. It's not because it's the only option at all. Because we have seen students over the years becoming teachers, going into data analysis, or becoming a biostatistician. And if you look more into the public and private sector, we see people being in all kind of consultancy roles, like healthcare consultant or public health consultant, healthcare researchers, of course, but also policy advice or strategic advice, prevention strategist. So there's a lot of opportunities after this master because you're going to be well equipped to work in very many domains, having this background. Now shortly about who can apply. Well, basically a lot of people. So we invite people from psychology and sociology, but also biomedical backgrounds, life science, economics, health economics, business administration, basically anything you can think of. If you feel like your study is not exactly in this page, then always feel free to contact me and I can think along if we think that your background suits well with this program. One thing that all students should have in common is a basic knowledge of statistics and a good proficiency of the English language. And Maria is going to explain a bit about what, for example, the statistical exam means during the selection process. So in the end, what are we looking for? As mentioned in the beginning, we are looking for motivated students. That's one of the key aspects in this process. We're looking for curious, critical, and creative students. We are looking for analytical thinkers, but most importantly, interested also in people who are interested to collaborate in interdisciplinary teams and to work from this perspective that we need multiple angles to look at the health care and health challenges nowadays. And for those who are ready to make an impact on the future of healthcare and prevention. So shortly, the application deadlines. For those who need to know early in the process or as early as possible if they are going to be admitted, 15th of January is the early bird possibility. This doesn't mean anything about you don't have higher chances, I would say. It's just that you know it earlier if you need it, for example, for a visa. 1st of March is for non-European students and 1st of May is for all European students. And now I would like to give the word to Maria.
Good morning, everyone. As you can already see, this is my cohort. And today I will talk to you about who I am, why did I choose the CP Master Program, a bit more of the application and the selection process, my personal experience with the Master Thesis project, and then we'll wrap up with group work and group fun. So I am Maria. I am 24 years old and I come from Greece and Cyprus. I completed my bachelor studies in nutritional sciences and dietetics in the International Hellenic University 1.5 years ago. And now I'm a second-year student in the clinical and psychosocial epidemiology program, following the track of health systems and prevention. Why did I choose this program? Well, you can see many of the reasons already on your screens. One was that we have really small cohorts in this program. My cohort consists of 13 people. The cohort before me was 15, and the next is again around 14 people. So we work very closely with each other. It's an interdisciplinary environment because the students have various backgrounds like medicine, psychology, nutrition, spatial sciences, and any other discipline that you can think of. Of course, it was important for me that it was a research master program and that we had different options for the tracks. And my main interests were to bridge research and policy, and they were on the field of public health and health systems. I was also looking for good communication and support from the administration, since having to do a research master can be difficult, and it's important to have an environment that it's supportive of you, that you can ask for advice or anything that can be discussed. And of course, in the end, I was interested to be able to apply for a PhD position and continue in academia. The application and selection process might look a bit intimidating, but my own experience was smooth, to be honest. As Flora already mentioned, the keys for your success is your motivation and to have aspirations for your future. What made this process smooth for me is that the CPE office is there from the beginning, and they are providing you with support, preparational materials, explanations, and any other advice you need during this time. So, as you can see, there are different stages for the application and selection process. First, we begin with the application. I was one of the early birds because I was really keen on learning my results fast. And then we got invited to have an entrance exam on very basic statistics. As I already mentioned, we had preparational materials given to us beforehand. And what I found very helpful was that this material have a diversity. They have videos, there are PDF files, so every student can find something that they can use and it's more helpful to them, for example. And then you have to conduct an interview about a research project that you conducted or that you were part of. Well, during my application, my entrance exam results, they were a bit above average. So I knew that I would have to answer some questions during my interview, but this went very well. And my thesis that I presented was really not in the spectrum of what you already heard. And but they saw I was very motivated and I was interested into making a difference with my research in society. Of course, the results are shared with you shortly after the interviews and everything that is done, and then you will know if you will start in the next academic year with this program. Regarding the master thesis project, a bit on the technical side, a list of master thesis projects and topics is getting handed to the students. There were 15 different topics and projects for 5 HSP students in my year. They were very diverse. They were from different departments within the UMCG with different supervisory teams. And we already knew if there were options to tailor this project on our interests or do something tiny bit different than what it was stated already in the content. Then based on your interests and the motivation you give, you get matched with a project and a supervisory team of senior researchers. Regarding the supervision, it looks pretty similar for everyone, but in my case, I have an interdisciplinary supervisor team. They are collaborating between the departments of health sciences and psychiatry. And my supervisors have various backgrounds like occupational medicine, health economics, and psychology. We have biweekly physical meetings, and once a month we have a bigger meeting with all supervisors so that we can discuss progress, time management, and other things. And what I like the most about the master thesis is that you get the flexibility to work with the department and from your house, and that you really get embedded and see how research is done in a university department. A bit about my own project. I am working on unmet mental health needs in the north of the Netherlands. as you can see on the map of your screens, we have different percentages for psychological complaints in the different regions of the Netherlands, with some having more complaints and some having less. So there are some differences between the regions and probably some disparities. We already know that 4 out of 10 people in the Netherlands experience mental health issues, but not everybody receives care, and this results in unmet needs. These unmet needs could be influenced by individual and healthcare system related factors, like, for example, the severity of the mental health disease or the availability of the personnel in the region the patient is located. How we're conducting this research is by merging two different databases, one from the Lifelines cohort study here in the north of the Netherlands and the registries of the Netherlands, so that we can have all the information needed available. It's very interesting because this information comes from real inhabitants and it's real world data, so it's a very good experience. By mapping these unmet needs and exploring their associations with these factors, we can give advice, and then interventions and policies can be done in order to reduce or prevent these unmet needs. And then we will enhance the well-being of the population that has these issues and their overall quality of life that will result in more healthy years. I am following the HSP track, so I have a non-academic internship at the moment in collaboration with the Municipal Healthcare Services of Drenthe and the Data Werkplaats of Mental Health, which is a collaborative effort in the region of Drenthe to bring all the available information and data of their inhabitants in one place. And for my internship, I'm looking into the waiting lists and the waiting time people experience during their consultations to begin their treatments, and how this data is collected in Drenthe, but also in the whole of the Netherlands, in order to give some advice to the policymakers of the regions and in general, how to collect their data more efficiently for researchers, but also for policy advice. Of course, you have heard a lot from us, and this master can be a bit intense, but with group work, we have also group fun. And of course, there are moments that you really have to study more and improve your skills or do more. But since there is a small cohort, you can really communicate with your classmates, make friendships or new collaborations, have new cultures that you can find something interesting, and then you can just enjoy your time also as a student here in Groningen. As you can see, we did a Christmas lunch last year and we did a Secret Santa, so we exchanged gifts with one another, and some of our classmates didn't have the opportunity to do this before, and it was very nice to share these differences. Thank you.
Yes, so it's my turn. Good morning, afternoon, and evening, of course, everybody. My name is Mateus. I was a student of the CPE 8 years ago, actually. We started in 2016. This also on the picture is the cohort I started with. And I would like to start talking to you a little bit. Oh, yes. Talking to you a little bit about my trajectory, actually. So I'm sorry, there's a cat trying to participate. I'm Brazilian. I did medicine there, and then I did my specialization to become a internal doctor. After that, I decided to move to the Netherlands to work with research. So I joined the CPE, did it for 2 years, and after that I moved on to a PhD with the same team and on the same topic. And after my PhD, I started working as a teacher of medicine in the University of Groningen for bachelor and master students. They asked me to talk a little bit about my memorable experiences during the CPE. I found it a little hard to find one specific because it's a quite diverse environment, diverse activities. So it's actually, you get to do a lot of different fun things. I put two pictures there for you to see like the different settings we have. For example, on the lower left, you have a picture of the classroom, which you see it's a rather small group, so you really get to have contact with everybody and have like a close relationship, not only with your teachers and supervisors, but also with your colleagues. But I really like the picture on the top left. This was one of the assignments we had, for example, that we had to observe. This was for basics in psychology, and we had to go here. I'm McDonald's or Burger King, something like this, observing people, making notes, and using these experiences to learn a little bit more about psychology. So you get to do a lot of fun and mostly varied things, which really help you get a little bit an idea of different possibilities for your future. And what I think I learned a lot during CP that helped me a lot in the future was, of course, the research I did. I worked with health literacy in chronic kidney disease patients. But more than just the topic I worked on, I think doing the master's really helped me with networking. That's also very important. Many of the opportunities I had before and then I'm getting even now had to do with the people I met there, not only students, but supervisors who get to work or have contact with people from different departments. So this helps a lot in your future as well. And the learning of different skills. Because what you learn in your project, it's usually very specific to a certain topic that can be quite restrained sometimes. But in any case, during your research and in the courses, you're going to learn a lot of soft or transferable skills that relate to problem solving, to working in a group with different expertises, different backgrounds, statistics, project management. You have courses on that. So this are things that even if you do not want to go on with that specific research would help you in future paths. I'm going to tell you a little bit more about that in a bit. But to tell you about the different possibilities, I have the right picture. It's also a picture of my cohort. And here there are people who went also to teaching, PhDs in Groningen, other cities in the Netherlands, outside of the Netherlands, into industry, people that went to work as psychologists, and actually many others. So, well, the possibilities are quite broad. And here, I wanted to tell you a little bit more about how CPE helped me to become an independent researcher, and maybe even more than researcher, an independent professional. So on the left, you see a picture of the defense of my PhD, which I defended last year. Quite some people go on to do that. Be aware that you not necessarily know that yet. When I started the master's, I had no intention at all to do a PhD, but eventually I just thought it was fun. I mean, it was nice working with the group. It was interesting, so I went on. And then after that, you can go on postdocs and other things related to academia. But as you see on the right, I also became a teacher in medicine. And this I did for a year, but now I'm going to move on. I'm moving away because I'm working. I'm going to work with Doctors Without Borders, possibly in a managing position. I also got invitations to work, because we work a lot of project management, in managing positions in other types of institutions, other type of events, even like sportive events related to medical staff. So it's very broad. What I'm trying to say is that the sky is the limit. Here you're going to learn a lot about doing research, but you're learning a lot about becoming a professional in general. So that's very useful for whatever you want to do in the future. And finally, some things that I learned and that I would suggest if you decide to follow the masters is, first of all, connect with your colleagues. Maria already said that, but the time in CPE, it was very useful. It was a lot of work, but it was like very much fun. So it's really nice to be with so many people from different backgrounds and just like getting to know each other, doing activities together, learning more about other people. And this kind of small setting where you get to know people that are different from you, it's also good to broaden your horizons a bit. So it helps you to become, even professionally, to become more open-minded, I think, knowing how to talk to people and how to listen to people. So take this opportunity for the fun and for what it can bring to your professional life. Trust the process. We already talked that you need to know a little bit of some about statistics and all the things you just did the bachelor, and maybe you're a little bit like worried about this is a research master. Am I good enough? Can I do it? I don't know everything so well yet. This was exactly what I had at the beginning, but what I really liked in the masters, which was very different from what I was used to in Brazil, for example, is that here I want not to say that they take you by the hand completely, because they also give you independence, but they also train you to do whatever you're supposed to before they ask you to do that. So you have a course and then you apply it, and then you learn something and then you apply it. So it feels very natural to navigate the process because people are always there to support you, and it's structured in a way that it just makes sense. And then you feel at a certain point that you can just do things and you go and do, and it works out. And the last thing, Flor and Maria already said that at a certain point you need to choose a research topic. My experience is when you do that, try to choose something that suits you, both the topic but also the people you're working with, because as I said, you might just be working with these people longer than you expected, and it's always good to be in an environment that suits you, let's say. And that's it. Thank you very much.
All right, thank you, Mateus, and also thank you, Maria, for your presentations and your honest experiences. I would like to continue to the Q&A. I'm here to answer the questions. Of course, Maria and Mateus are, but we also have Andrea de Winter. She's the program director of this program. So she's probably also taking the mic to answer the questions that you have. As I said in the beginning, please feel free to open your mic and ask your question. If you do not feel comfortable doing that, you can also put your question in the chat box, but you're warmly invited to use your microphone as well. Are there any questions? Let's see. A question from Bright Kumi. I will just read it out loud to all of you, but also for the recordings. Due to the noisy background at my location, I would rather ask my question through the chat. Yes, of course, that's fine. My question is, I am a Ghanaian currently living and working in the Netherlands under the EU temporary protection displaced person from Ukraine for 2 years now. Do I need to strictly apply to the program as an international student? And B, is there any other Dutch residence permit that allows a foreigner to get access to the study program other than the international student route? And is there a scholarship available for people in my situation? I think, Bright, that this is a very specific question that can better be addressed one-on-one. I would kindly ask you to send me an email. The contact details will be afterwards, because this is such a specific situation that we need to look into that I don't think I can answer them straight from the back of my mind. So if you don't mind, I think it's better to have a one-on-one contact about this, and we'll definitely look into your situation to see what's most suitable. Is that okay for you? Let's just see. Perfect. Thank you. Are there any other questions? Marlene says, I study interdisciplinary social science. Can I apply to this master program? study interdisciplinary social science. Where are you doing this, Marleen? Let me see. I haven't heard about this specific one. It sounds like it's based at first glance. It looks like a well-suiting master also to this bachelor to this program, but I have to look into the details to make sure. But at first glance, I think it is. But I can have a look. So also send me an email so I can check the program, read about what the courses are, etc. So I'll just look online and see how it works. Yeah? I said my email address already in the chat, but it will also be on the slide. I will just put my first slide already here about how to get in touch. So just people know that you can send it to the email I put here in the chat, but also to cpe@umcg.nl or by using the WhatsApp icon on the screen. Are there any other questions?
I see a question in the room chat from Dimitra. Hello, I would like to ask, does this university offer dormitories for students?
No, in the sense that students need to look for their own housing, if that is, if I understand your question correctly. So there's a lot of student houses, but you need to find them yourself. We are not offering anything, unfortunately.
Perhaps I can add something about the question of the previous question about the master program, and perhaps also comment about the tracks. I think if you have studied social sciences, I think that's a very relevant discipline, just like other disciplines like psychology, sociology, or medicine. We have a huge number of backgrounds, so most of the people have a relevant backgrounds to study in this program. So it's, well, what already also is being said about Floor, it's about motivation, and it's about that you have an interest to work with large quantitative data and to analyze that and to work on complex health challenges in society. I think that's the most important thing. And then in addition about the tracks, I know from a meet and greet in the past that some students said, well, I find it very difficult to choose a track because both are very interesting and relevant to me. Know that you, in the first block of our program, will also get more information about the tracks, and you will work with the tracks already a little bit. And when you discover that you made a choice which this doesn't fit sufficiently to your interest, you are also able to change the track. So this is a decision being made to reduce a little bit of stress about the best decision ever about the track.
Thank you.
Alison has a question.
It's not loading at my place, but if you can read it already, Maria, please feel free to read out loud.
I just saw a raised hand, to be honest.
Hi,
So,
can you hear me?
Sorry. Yeah. Yes, we can hear you.
Thank you for your presentation. I was wondering about the application process. So if we don't apply before the 15th of January, will the assessments happen after the 1st of May for everyone, or is it intercalated depending on when you apply?
Yeah, good question. I think, Andrea, you're probably better aware of this process.
Yeah. Thank you, Floor. And I think it's a very relevant question. I can imagine that some of you will not meet the early deadline, and that's not a problem. As soon as we get an admission, we are processing it because we have, of course, a lot of admissions, and we don't want to deal with it with all the admissions after May. So as soon as you go through the process and we select you for the program, you get already the information that you are being selected based on our criteria. Is that a answer to your question.
Yeah, thank you.
Okay.
Let's see. Yeah, Hilda was answering to Dimitra's question. Yeah, let me see. Bright, you're asking for international students. The route is the fee of 24,000 for both 2 years, or is it for yearly? Unfortunately it's yearly. The fee for non-EU students is indeed 24,000 euros per year, so approximately 50,000 in total for the 2 years together. Yeah, and that's only for the non-European students. So the EU students pay the same amount as the Dutch students do. Are there any other questions in the chat, or if someone is using the microphone, please feel invited to ask all the questions that you have now, because we're now here for you, of course. But there is also a meet and greet, which is next week on the 29th. You can see it on the screen. And this is, again, a sort of informal meeting. I will be there, but also, again, some students and alumni to tell you more about the program from their perspective, go more into the details, and also have like this informal Q&A only with the students and me. And alumni. So yeah, feel very welcome to join us online if you feel like I want to learn more, or I want to hear more from the student and alumni perspective. So book your spot. You use the QR code, and we hope to see you there, of course, as well. We will stay around until everybody leaves this presentation. So for those still having a question, please feel free to use the mic or the chat. And otherwise, I would like to finish this presentation. Matthäus and Maria, again, many thanks for your input. To all the prospective students here, many thanks for your interest in this master. If you feel like you need someone to think along with you about the decisions that you have to make or the doubts that you have, you're very much invited to book an appointment with me. We can do it online, of course, or if you are in the Netherlands or in Groningen, then of course we can also meet here at the faculty. But please reach out. I'm happy to help. I'm here to help. So please make use of that. And otherwise, I wish you all a good morning, evening, or afternoon.
Alison.
Hi. Can I ask another question?
Sure.
I was wondering if you could provide some more insight on the different internship positions that past students have undertaken.
I think, Andrea, you are maybe more aware again.
Well, there is always a variety of internships, and what we strive for is that the internship is also relevant for your research. So it could be a public health institute where you then work in a non-academic field, for example, in youth, or if you have a topic on infections, it could be that you worked in another part of the public health institute. But some people are also working at a knowledge institute, for example, a knowledge institute related to mental health issues. So it really depends on what your research topic will be and what you will have as research questions, because the internship is about strengthening your research questions and strengthening the quality of your research. And the same is true for the field trips we have in the Life Course Health Development track. For the field trips in the health development track, we, for example, visit one day at the Ministry of Health, and we learn from what they have on their agenda, what their challenges are, and you are able to ask a lot of stakeholders questions, and those answers will also help you to improve your quality of your research. So think about the field trips in the life course health development track or the internship as a way to stimulate your experiences and to broaden your scope, although we do it in a different way in both tracks.
Okay, thank you.
Do you have a specific interest that you say, well, I would like to, I'm asking this with something in my head, because then I can even be more specific?
Not at the moment. I was just
Okay.
curious about, what
Okay.
directions people have taken. Yeah, thank you.
I don't think there are any more questions, so I think I will just close the entire session myself. So thank you all again, and we hope to see you at the meet and greet, or otherwise we will see your applications hopefully in the future. Have a good day all.